This adjustment is a supine hypothenar proximal clavicle with distraction for an A to P glide restriction of the SC joint. This adjustment looks almost identical to the same adjustment for the AC joint. We'll be using a hypothenar contact and contacting the proximal clavicle in this instance rather than the distal. We'll be using a similar distraction here, so just an elevation of that shoulder slightly here. Remember, our patient wants to give us kind of a spaghetti noodle here, nice and relaxed. So we'll palpate that proximal clavicle. We'll use a hypothenar contact. I'm going to distract up slightly, apply a little bit of force, and then straight down. Remember that in the lecture we talked about dislocations, posterior dislocations of the SC joint, and this is an extremely strong joint, but remember that we don't want to apply a whole lot of force here, A to P, as we could potentially injure our patient. So this is a mobilization. You'll use a lighter force when you do this adjustment. This was a supine hypothenar proximal clavicle with distraction for an A to P glide restriction of the SC joint.